Now, to share what she's seeing in the sector, let's bring in Rebecca Walser, President, Walser Wealth Management. Rebecca, welcome to Market Overtime. Thanks for joining us here. Let's just start from the top. Rebecca, what is your macro outlook right now on healthcare stocks?
Yeah, I'll tell you, Scott, I'm not a big supporter right now of Pfizer, Moderna, which obviously, you know, Moderna, they've had, this is their only product. So their financials are going to ebb and flow with how well Moderna, the actual, inoculation performs. But the reason I'm concerned with Pfizer and Moderna is these booster shots. You know, we expect that the booster shots are, first of all, they're coming 8 months after the original people. So they're already authorizing boosters after 8 months. And what I'm seeing is, I'm not talking about initial vaccine hesitancy, people that never got the shot to start with. I'm seeing potential vaccine hesitancy for the boosters. And it's interesting that both Pfizer and Moderna specifically are looking at boosters so early. What that indicates to me is that they missed their projections on initial inoculations for the vaccine hesitancy, hesitant people. So what you've got now is them saying, all right, well, maybe X amount of percentage of populations across the country, across the world didn't necessarily take a part of this first one. So let's go back to the people that took it and let's get them a booster. And I'm obviously not saying that there's not medical reasons for this. I'm just talking about the financials and the projections, right? And so it concerns me that we're having to rely on boosters so fast, because I think that will actually potentially make more people leery of taking a vaccine that they need a booster for just after 8 months. So I actually think this could be a bad thing in this cyclical, rollout of these gene therapies.
Got it. So maybe not seeing so much opportunity with Moderna and Pfizer, even though these are some pretty big names. What stocks do you think investors should keep their eye on with this in the healthcare sector?
I'm so glad you asked that, because what I really think is the way forward for medicine, and we're all seeing it, is the AI space on biopharma. So we're really looking, and there's been some really unique partnerships that have come out in the last 2 years. So in 2009, Novartis basically partnered with Microsoft to use Microsoft's AI technology with their data to more quickly go to market with new discoveries, new things, and they're empowering their employees. You know, obviously it takes a little bit of time to merge AI and science together, but the AI space, Scott, is really where the frontier is going to be in medicine. And the stuff that is coming is unbelievable. I can't even describe it in such a fast clip. But I would say Novartis is AI geared. And another one that has really got our eye that we're really looking at is Bayer. They're based in Germany, really huge, but they also are really looking at AI for product development and future product. And it's in the AI space. The computers learn so much faster than the human brain. And so they are able to leapfrog what might have taken, 10 years of discovery time on maybe a long cell T cancer cell. They can leapfrog that in a matter of, potentially even months. So this is the new space. So I would say I'm really looking at the pharmaceuticals that are really incorporating AI, because that's the new frontier.
Wow, Rebecca, this is an interesting twist, combining AI with healthcare, not something that always comes to the top of a long-term investor's purview, if you will. I'm looking at the overall sector of healthcare, up about 19% year to date, so doing okay, but very interesting take on what you're talking there. Now, the stocks you're watching, are these, some of the names that you just mentioned, are these more of long-term plays or short-term plays potentially?
Yeah. Anybody that tells you there's a short-term play in AI either has just discovered and it's already publicly information and it's too late. Yeah, these are absolutely long-term plays, because obviously, Scott, we don't know what's going to be developed in this AI space. This is a new frontier, blue ocean, if you will, in our space. And so this is a new frontier. So it's going to be a longer-term thing. Could we get a pop right out of the gate in the next 6 months and have a new technology? Absolutely. But we shouldn't count on it. These are going to be more long-term, long buy holds for the AI space, and seeing medicine and cancer potentially looking at the eradication of cancer in the next 10 years with some of this AI stuff. I mean, to give you one glimpse of how sophisticated these things are with AI and the brain and all of these things. In a class that I'm in the global executive program for London School of Economics for my MBA, and we were doing an AI session, and one of the world's preeminent AI experts came in and talked to us how they were already able to transfer emotions from one, rat basically to another rat. And so there's so much to be developed in this area, Scott, and long term, it's going to be a massive moneymaker.
Got it. Well, like I said, the return on the sector, the healthcare sector, up 19% year to date. What's your outlook for the potential return for, going forward the rest of the year? Is there still room for some advancement there?
Well, so again, like I say, a lot of analysts are looking at, Moderna and Pfizer and the boosters as an additional revenue maker. I'm sort of discounting that and saying that they're going for the boosters so fast because there was a lot more vaccine hesitancy globally than they expected. So their initial rollout numbers are less than expected, and the booster will come back and help that. But that's not really what we needed to count on from the beginning. We needed the revenue, numbers that they were projecting were basically based on a wider swath of the population generally accepting these really new, inoculation developments in this year. So I'm not looking at the boosters coming online as a positive right now. I'm seeing that as a negative in my view of what's happening because I had already priced in the inoculation. So the fact that we have to come up now with the booster so fast is actually, in my view, a negative.
Okay.
Unfortunately.
Well, Rebecca, thank you for opening our eyes to not just the healthcare sector, but how it can potentially combine with AI and think about those potential places in a long-term portfolio. All right. Thanks again. That was Rebecca Walser, President, Walser Wealth Management.